I'm Anita Allen. I'm a professor here at Penn Law School, and I'm also a member of President Obama's Bioethics Commission. In the Guatemalan incident, which was between 1946 and 1948, U.S. Public Health Service doctors went to Guatemala with the cooperation of the Guatemalan government and began to study whether or not certain protocols could help to reduce the incidence of sexually transmitted diseases. But the research protocol they used involved deliberately infecting people, including prisoners, soldiers, sex workers, mental patients, and others with diseases, syphilis and gonorrhea in particular. And some of the people who were infected were never actually treated. The commission found that there were a number of problems with the research in Guatemala. It's shocking, I know, just to even hear about it, but the specific problems were that the research protocols that were used were scientifically invalid. They were based on under-rationalized protocols and on inconsistent and ad hoc scientific approaches. Moreover, because the research did involve a failure to get the informed consent of the subjects, the research violated both contemporary and past ethical standards. The report that the President will receive from the Commission in September will have a number of key findings. One of those findings will be that the scientific validity of the research that was conducted is limited. The second important finding is that there was a lack of informed consent on the part of the researchers. We do know that in similar research that happened in the United States, there were efforts to get informed consent, and there were efforts to minimize risk. That did not happen in Guatemala. And the final finding is going to be that the standards of ethics that were in play in the 1940s were not adhered to. Ordinary morality was not adhered to. The principles that stemmed from the Nuremberg Nazi tribunals were not adhered to. And then finally, there were at the time recognized research standards that were promulgated through, for example, the American Medical Association, which were not being adhered to. The Commission's report will lay out all of the ethical frameworks that could have been used in Guatemala, which were not, and will also, again, explain the responsibility in terms of who was involved, why they were involved, and what we can do to make sure these things don't happen again in the future.